Welcome to the Long-Term Care Chronicles podcast.
Thank you so much, Bill, for coming on to the Long-Term Care Chronicles. I really appreciate it. And if you could just take a moment just to explain your group's organization a little bit and before we get started. Thank you.
I'm happy to do that, and thank you for inviting me. I'm very pleased to be here on behalf of CARP. CARP is a national organization. CARP stands for Canadian Association of Retired Persons, although we don't use that full name very much anymore because so few of us can afford to be retired. So we just use the word CARP. We're Canada's largest organization advocating on behalf of older adults. We have 325,000 plus members right across the country. We have active chapters in every province, and many of them in Ontario. In Ontario itself, we have almost 100,000 members who are very active across the province, and we advocate in all areas of concern for older adults. But our chief areas of concern are, of course, health security, financial security, and dealing with ageism. Ageism, of course, which is rampant these days in the whole area of health, especially in long-term care. I'm the Chief Operating Officer and the Chief Policy Officer of CARP, and we have a very small staff, 5 people in Toronto, but we're supported by our chapter executives and volunteers right across the country.
Perfect. Thank you so much for that. And so we'll get started here. And on your website, you have the petition that you started for the Minister of Long-Term Care in Ontario, Minister Fullerton. And why is it that you're looking for her to be released from her current position? And why not the Minister of Health, which would be Christine Elliott, and as well the Premier of Ontario? So I'll let you go ahead with that.
Those are very good questions, and it comes down to simply this. Ontario is the only province that has a separate ministry for long-term care. So we would expect that Ontario would have the best program and support of long-term care in the country, and obviously it doesn't. So what we want to do is shake up that Ministry of Long-Term Care and get them to be more effective. Now, the Premier is in his office until another election, so we cannot, reasonably suggest that he get fired. The bureaucrats within the Ministry of Long-Term Care are comfortable there because they are comfortable as bureaucrats are and somewhat protected from being fired. So who's left but poor Dr. Fullerton as the minister? The buck has to stop with her, and I'm sure she is a very nice person. We know that she's a doctor with 30 years experience, so we feel that probably she's not getting the support from the Premier or her ministry that she should, and the only option we have is to call for action, which is to remove her. It's too bad we can't go after the others too. They're equally or more responsible, but that's what we've aimed on and what we hoped would happen. Whether the minister gets fired or not really doesn't matter. What we want to do is wake up that Ministry of Long-Term Care and get them to start acting and taking the actions that they should have years ago. Remember, some of these situations are here and have been here a long time because of previous governments, but the bureaucrats have been there, the same bureaucrats in those departments, and they haven't been taking the proper action either. So it's all focused on this Ministry of Long-Term Care, and there has to be change there. And the only way we can do that at the moment, with our now over 5,500 signatures on our petition, is highlighted by calling for a change in the minister herself.
that you have over 5,000 on your petition, and I'll make sure to include that where people can go to sign that as well.
It's gone over 5,500 today, and I expect if I looked again, which I haven't in the last hour, it's probably gone up again. We'd love that. We would really like all the people who are watching this to go to the carp.ca. It's that simple website. It's right up beginning of the front of the website, and sign the petition, make the comments, and help us take this message to the Ministry of Long-Term Care.
Perfect. Thank you so much. And then with all of the seniors that are living in long-term care, and prior to COVID, they've been pretty much hidden, forgotten, neglected, and of course, in some cases, even abused to experiencing the horrific conditions that have been outlined in the Canadian military report. And this took back in late May of 2020. And for years, caregivers, even residents, complained to the ministry about the conditions, but issues were never resolved. What would you wish you could say to the current members in government, what you would hope to say for the future members as to what to look forward when living in long-term care?
Yeah, well, first of all, it's wake up. This is no way to treat our loved ones and our family members who are in long-term care. And it's got to be fixed, and it's got to be fixed now. Healthcare in general, and for those residents of long-term care has been horrible in many cases. Not in all long-term care facilities, and we're not in any way blaming the wonderful frontline workers who bend over backwards to support and help our loved ones in long-term care. But obviously the government supports aren't there, and they're still not there. You would have thought, I mean, we're 10 months into COVID now. Didn't they learn anything in the first wave? They had the downtime in the summer and the fall when, and every indication, all the experts said the second wave would be bad or worse than the first wave, and that's turning out to be true. They did no planning, they took no real actions, and we're still hearing the same problems. Things like we're hearing directly from frontline workers that they don't have adequate PPE. An example is the masks. We know in many long-term care facilities, even though the government says we've spent money and there's lots of PPE, well, it must be in storage somewhere because it's not getting to the frontline workers. And we're having frontline workers tell us that, for instance, they're given one N95 mask per day to wear for the whole day. Well, anybody who's ever used that kind of mask knows that with having to take it on and off during the day, as you do in your natural times, whether it's for breaks or lunch or anything else, it doesn't stay effective if you're using it all day. Why aren't they allowed more than one? And frankly, even if the medical research showed that one mask was good for the day, if it makes the frontline worker less anxious and more able to do their job, if they have the comfort of more than one mask, then why not give it to them? It's this is not a government and organizations and long-term care are not looking at things from the patient and the worker's point of view. It's all system from the top down, and it's bad system. We've got to start listening to the families, to the patients themselves, to the residents themselves, and to the frontline workers, and start acting on them, not by looking at reports and pontification from senior officials.
Absolutely. I couldn't agree with you more on that one. And I just wanted to know as well, what is CARP's vision for the future of long-term care and aging well in Canada?
Well, our vision is we've got to stop warehousing our older adults. These large, old facilities with multiple people per room, it just can't stop. Can't continue. This long-term care system we have was based on the old British poorhouse system earlier, with many people packed into a hospital-like setting. We know today that's not the way to do it. There's all kinds of research and examples of good ways to look after our older family and older friends in long-term care. Lots of people these days know about things like the Butterfly Project, and there are many others that show the right way to look after people. We don't need to build huge facilities. When we need our people to go into the kind of care that they could only get in a congregate setting, then we need smaller facilities. We need them to be on one floor. We need them to be big and bright and happy places to be. And when we hear the Premier is talking about fixing the system by building more of these large homes, that's just ridiculous. It's not looking at the science. It's not looking at what's current. It's not looking at what's being done in other countries, especially in Scandinavia, places like Denmark, where they have totally turned around the system. And surely if they can do it, a country like Canada can do it. It's not that we're not putting enough money toward it. We're just not spending the money in the right way. So the first thing to look at is not building these huge facilities with way too many residents to handle, but to have smaller, more workable situation, campuses, if you like, as some are doing, where there are a number of these homes together. That's the first thing. The second thing is to make sure we have enough employees, frontline workers. And we know the government said, yes, we have a plan now. By 2025, we're going to have enough frontline workers. Well, the older adults, your family and my family, our friends who are in long-term care, many of them don't have until 2025 to wait for something to change. It's got to happen now, and we need action now from the government, not future plans down the way, which will probably be after some other government is elected, and who knows what they'll decide to do. And the third thing we need to do today is to realize that this is an emergency. The house is burning. We've got to put it out. And anything that's long-term planning at this point is not going to help today's issue. There's a lot of focus on the vaccine these days, and even it's not being delivered very well, but there's a focus on it when it's almost like chasing the horses when we should have closed the barn door. What about the infection controls that were supposed to have been in place months ago, yet we have, although limited, government inspectors telling us now that they find inappropriate infection controls are still going on. Even the Long-Term Care Commission issued a report that they weren't asked to last fall that highlighted that the proper controls were still not being done. So we want the focus now to be today and fixing today's situation. Sure, plan for the future when you can, but realize that the house is burning and we've got to put it out today.
Thank you for that. So going forward, so would CARP be for the national standard conversation for long-term care moving forward, and for at least to allow our seniors to age gracefully?
Absolutely, and national standards are key, and they should be the same across the country. Your postal code should not determine the level of health care that you get. So we need standards in every province, and we need standards that are the same across the country, and we need standards that are enforced. There are no, they're not the same standards across the country. We don't have good standards. If you talk to somebody from the long-term care ministry here in Ontario, they'll tell you that there are standards, but you can't see them being enforced. We know that many of the inspections that were being done were by telephone. Can you enforce or regulate standards by inspecting something by telephone? That's ridiculous, and everybody knows that can't be done, but that's what we're being done. So we would really like the federal government to finance national standards, and in that way put strings on them to the provinces, so the provinces don't get the money unless they set those standards and then they enforce them. Standards are no good unless they're enforced. We need to have both, but that's certainly what we need, and we need it right across the country, so that and this is equal standards, and maybe in this way our standards in Ontario will come up to some of the practices that are actually better in other provinces across the country.
No, I'm glad that you mentioned that, because across the country it's different. Like in New Brunswick, most of their long-term cares are non-for-profit, while in Ontario, the majority are pretty much for-profit. So that type of a model should be, I would think, at least the same across the country, and
Yeah, and
maybe part of.
and it shouldn't matter whether a facility is profit or for-profit. That's, that the for-profit or not-for-profit is a bit of a red herring, because there are some very, in Nova Scotia, for instance, there huge outbreak where over 70% of the deaths in the province of Nova Scotia in long-term care happened in one not-for-profit long-term care facility. So it's not necessarily for-profit or not-for-profit. It's the age of the building, it's the staffing of the building, it's the management that's being done, and it's the standards that are held. And if for-profit can meet high standards, if not-for-profit can meet high standards, then they'll be doing what we want to do. And whether or not they're for-profit or not-for-profit is not an issue.
Perfect. Thank you for that. And so now many caregivers have not been heard and have instead been neglected and often ignored, yet are an essential group in the overall care advocacy and help for seniors and to live better. So would you say for your organization that you see a role for the essential care partner, and does your organization support caregivers so to continue to support seniors living in community or in long-term care?
Well, we certainly, CARP certainly does support caregivers, both paid caregivers, frontline workers in facilities, and family and volunteer caregivers who come in from the community to help. And we think that both groups are being forgotten in this. The paid caregivers are not being paid enough, and they're not being given the tools they need to give care. And the unpaid caregivers are unappreciated. They're not supported. We want to have financial support and incentives for volunteer caregivers too, whether that's tax relief or other support to allow them to do it. Because in many cases, family members and friends have to choose between working or caregiving, and if they're doing that, there are some specific financial supports that CARP has recommended both to the federal government and to the provincial government of how we should support both groups, because this problem is not going to go away. As we're all very aware, the number of older adults in our country is growing all the time, and although people are living longer, there's still more and more of them at the end of their life who need this kind of support. And we've got to be planning now to look after those greater numbers and do it properly. And that means more caregivers, both paid caregivers and volunteer caregivers.
No, thank you. That's great to know, because definitely caregiving definitely has a lot of responsibilities, and as well you touched upon in terms of the financial aspect for caregiving for a loved one.
If I could say, a little more, what the officials have to do, both the people who operate the long-term care homes and the government regulations, has to recognize that families and family caregivers who are a very important part of this equation, and they save the government billions of dollars if we had to pay people to do the jobs they do. We've got to start looking at this whole system from the residents' point of view and their family's point of view, and find out what we can do to make life better for them. Not looking at it from a organizational point of view, saying, what can we do most efficiently for this organization? The focus has to be on the resident, the patient, their family, and the people who give them care.
Thank you for that. And then for seniors that are deemed like incapable, have no option to vote, nor do they have political representation, and in some cases they may be lucky to have family to advocate that is willing to speak on their behalf, does CARP believe only a seniors advocate for all Canada is sufficient to deal with seniors issues, or is a caregiver advocate also important? And also, what should caregivers be given as an opportunity to vote on behalf of a person that they are caring for, so the government pays attention to this growing population of seniors in this country?
Yeah, really good questions, and I'll take it in the two parts. First of all, in terms of an ombudsman of some kind, because unfortunately, although it may be, healthcare is a provincial issue, and so are many of the other social service and support things that our senior needs. We think we need that kind of position in every province. There has to be somebody arm's length from government with the power to initiate action, who is speaking on behalf of those who can't speak for themselves in the older population and their family. So as long as healthcare is decentralized into each province, then we think there should be that kind of advocate in each province, and that's what we are strongly recommending. As far as the example of voting is concerned, as early as yesterday, I was meeting with officials from Elections Canada, where we're talking exactly about that issue. How do we make it easier for older adults to have their say in government? There's talk today, and maybe by the time some people listen to this, we may know, but there's talk today about the possibility of an early federal election, which would mean we would have an election before COVID is gone. So how do people in long-term care vote? Our election officials can't come marching into the facility as they used to do and go room to room to collect vote, or have voting in the front lobby where everybody comes down to it. Infection control and people in and out make that impossible. So how do we make that possible? And one of the ways is by proxy voting, which is what you're talking about. And I'm happy to say that the people working in Elections Canada are very aware of that. CARP is working with them. We're making that kind of suggestion, and I'm pretty confident they're going to be recommending it. The problem, of course, is this is a political decision in the long run, and for something like that to happen would mean it would have to go to the House and be voted on, and whether or not that could happen in time for the next election is a real question. But in terms of the long term, we have to find better ways to make sure that everybody is able to keep their franchise, no matter what their age or where they live, and that certainly includes people in long-term care homes. And because we know that in Canada, as many as 95% of older adults vote in most elections. So they do want to partake, and we've got to make sure that the political parties support that. And one of the things we're doing is talking not only to the government itself, but to the caucuses of the various parties, saying we want you to support this too, so that you're not taking the vote away from people who want to exercise their franchise.
Perfect. That's good to hear. Thank you for all that information. And as well, I'm going to give you a scenario. So we would like, to provide an envision as a future solution, so our most vulnerable populations can live better and live well and live better, whether at home or in long-term care. And the scenario is this: For seniors who are unlucky to be deemed incapable after suffering a devastating illness or injury and not have a power of attorney in place and only have, let's say, a substitute decision maker advocating for them or not at all, they have a tough road in the long-term care system and risk placing their substitute decision maker in a financial deficiency with the Canadian Revenue Agency. Does not recognizing the substitute decision maker as a legal representative to handle their taxes, create a predicament?
Certainly, it certainly does, and CARP believes that's a situation. The whole area of financial security for people in this position is very, very awkward and often creates a huge problem for our people in long-term care, and CARP agrees that that this doesn't seem to be well recognized. We have been talking about it for some time with the various organizations that control this sort of thing and recommend it, and trying to educate them on the issue. But it comes down to once again our belief that decisions like this should be made with the person in long-term care and their family, not just about them. We need to involve them in the decision-making and the planning. It's because this is a legal issue. There are lots of ins and outs, and the lawyers can argue either side of what will work and what won't work. But the bottom line is we've got to make sure that that older adults are able to adequately manage their own finances and have a say in how those are managed, and work with their families to make sure that whatever is done in the best interest of the individual and not the system. And once again, we come back to this. It really is ageism, where somehow the system seems to feel that once you're over a certain age, you're incapable of making your own decisions, or the family is incapable of helping you make your decisions. And we've got to start looking at things from the resident's point of view, the family's point of view, and work out a way to make that work, not just a way that's easy for the system to handle.
I would definitely agree on that one as well. So in terms of, let's say, long-term care, why would you say that it's important for home care and community care to as well be looked at in conjunction and not as separate silos moving forward?
Yeah, well, at CARP, we believe that long-term care is in fact a continuum. It starts from the time that you beginning as you get a little bit older and you need some kind of health care and help beyond what everybody else who's younger gets, right to the end end of life. And it's a continuum, and a very important part of that is long-term care. But remember, only 5 to 7% of Canadians are in long-term care facilities. The other 90 to 95% are all living in their own community, in their own home, or with family, or with someone else. So we have to be concerned with people throughout that whole process. And most people, the vast majority, once again, our CARP surveys and other surveys have showed that over 90% of Canadians want to stay in their own community and their own home as long as they possibly can. So we need to help them do that. We can't continue to build long-term care rooms to keep up with the demand for all the older people who are coming along. In Ontario, it costs between $250,000 and $375,000 per room to build a new room. It's much cheaper when people are able to keep them in their own community. We also know that about 20% of the people who are now in long-term care would not have to be in long-term care if there was adequate community support for them and home support for them. And if we could get those 20% out of long-term care, keep them out of long-term care, then those long-term care spaces could be taken up by people who really need them, who have to have that kind of daily medical support that they just can't get anywhere except in a facility. So that's why we're pushing. And in some countries, I mentioned Denmark before, it's a good example. They spend 4 times as much on home care as we do in Canada, as a total of what they spend on long-term care in total. So we believe that supporting people to stay in their own homes as long as they can, and supporting their families in doing that, because families, when people are in their own home, it's more often than not families, sometimes friends, who are giving that extra help to allow them to stay in their own home. So although we're very concerned about long-term care, and we're going to keep pushing to improve the terrible conditions, in the long run, we see that keeping people in their own homes as long as they want to, once again, remember, it's their decision, not somebody else making it for them. As long as they want to, as long as they're able to, we should make that possible. And that means having adequate home care and community care within their own community close at hand. For instance, if we want people to stay in our rural communities, which we say we do, then we have to make sure that the healthcare services are available enough in those rural communities so people can stay there. Otherwise, they'll have to move to the big city, which they don't want to do, and we really don't want them to do either. So home care and quality home care and quality community care will just make the situations in long-term care facilities better, easier to manage, and more controllable, and certainly much better than it is today.
Thank you for that. And as well, I know that you've spoken in terms of the financial aspect of it. And I know in terms of, let's say, with the Canada Pension Plan, with that increasing, as well as restoring the old age security eligibility from 67 to 65, and as well the extra $1,000 a year for the Canada's poorest seniors. And would you as well say, in terms of reducing the seniors' drug co-payment, both in the province of Ontario and in Nova Scotia, that should as well be part of the focus?
Oh yes, all of those are necessary. It's the financial support to older adults right across the country here in Ontario and everywhere else is way less than it should be. And our CARP members and other older adults we speak to feel that even during COVID now, they're being ignored. They see thousands of dollars of support being given to other age groups in our country, and well needed, and not saying they shouldn't get them. They certainly should, but older adults feel they're being left out, they're being ignored when they hear of thousands of dollars going to other sectors. And what if they had this year? $300, maybe $500 if you were particularly poor, and that's what you've seen since the pandemic began. So I think it's very reasonable that older adults feel they're being forgotten and treated differently than the rest of the country. And these kind of supports that are relatively easy for governments to do through the whole taxation process, and tax rebates and refundable rebates are all things that seniors need and can use. One of the things that is not recognized by government, of course, and I'm sure that all your members could identify with this, no matter what your income is, most people are on a fixed income. It's not going up every year once you retire. There are some fortunate people who have worked for governments and others who have index pensions. Most people, in fact, across the country, only 30% of the people have any pension at all. The other 70% have their own savings, the Canada pension, and investments they've made themselves. So when prices go up for people in that age group, their amount still stays the same. Whether this was X number of dollars a year or X number of dollars a year, they're staying right there. So increases in the cost of living, which are happening all the time, and other areas really affect them, and that doesn't seem to be taken into account by the people who are making the tax rules. And frankly, sometimes we think that's because they're the ones with these indexed pensions and these excellent pensions, so they've never had to worry about that. So the people making the decisions, the politicians, the bureaucrats, don't have the personal experience to really understand what I'm talking about now. And what we're trying to do at CARP is educate them and get them to understand that if they want to continue to have the support of the people who vote, which is those older Canadians, they better start thinking about the financial security of those older Canadian voters.
Absolutely. I definitely agree with you on that as well, because as the population ages, and this is going to be a huge block that is definitely going up. And as well, we can't afford some of these warehouse models types of approach, because that's just completely unaffordable for a government or society. So, but I do want to thank you though for coming on today to speak on this issue, as well as where can some of our listeners be able to get more information from your organization?
Yes, well, CARP would be glad to have anybody get in touch. We'd love to have people join and become members. Membership is only $15 a year. It's not expensive. So we'd love to have you join. The easiest way is to go to our website, which is simply CARP, CARP.ca, and all the information is there. The first thing you'll see when you go to CARP.ca is our Fire Fullerton campaign, but information on all the other advocacy things that we're doing are there, and you can join online too. And also you can get in touch with CARP by phone. Just look it up in your directory or online. Or I'd be happy to have emails from any of your members and viewers. And my email is simply VanGorder, V-A-N, V as in Victor, A-N-G-O-R-D, D as in Donald, E-R, at CARP.ca. So VanGorder at CARP.ca. Love to hear from you. And if you're in a community that has a CARP chapter, you probably are aware of it. But if you're not, you'll find on our website a listing of all the various chapters across the province. And there are lots of them in Ontario, and you can get actively and personally involved with them and get them advocating locally with you on your behalf. I really believe that your organization and ours has a tremendous amount in common, and that's why I was so pleased to agree to come on and talk with you this afternoon.
Thank you so much. I really do appreciate it. And as well, your organization is national, so you do have chapters across the country?
Absolutely, every
yes,
province
perfect.
And the territories.
Perfect. But thank you so much, Bill. I really do appreciate your time. Thank you again.
Thank you.
You're welcome.